Myoactivation is the insertion of hypodermic needles into muscle fascia and soft tissue to release these tissues from a contracted state. Muscle become contracted in response to body trauma. This trauma can be from a specific injury or from repetitive strain over the years. A prolonged state of muscle contraction can result in muscle tension, poor muscle coordination, and can lead to pain and discomfort.
All treatments are covered by MSP for patients who have a valid BC-PHN and were referred to us by a registered practitioner. Our treatments are also covered by Pacific Blue Cross federal programs for military personnel.
Please bring or wear loose or stretchy clothing, including but not limited to t-shirts, tank top, shorts, or stretchy pants. There is a bathroom available if you need to change. You do not need to provide your care card.
At your first appointment, the doctor will start by gathering a comprehensive history of your pain, dating back to childhood, including any surgeries, scars, and injuries. It's important to mention everything as we want to focus on the whole body and not just the point of pain. They will then examine your posture and range of motion and ultimately determine which muscles need to be treated. They will palpate to locate the more significant areas of tightness. Where you're experiencing the pain isn't always where it originates from, so you may receive treatment in other areas besides where the pain is localized. Treatment is typically done at the first visit so you can get an idea of what it's like. The doctor will insert the needle into the tissue, simulating a reflex and muscle twitch leading to muscle relaxation.
You may find that the treatment is uncomfortable or painful. It will vary depending on your pain tolerance and how contracted your muscles are. Your pain tolerance may differ between different areas. For example, larger muscles may elicit a larger response compared to smaller muscles. The sensation itself is comparable to IMS and acupuncture. However, the needles will never be left inserted.
You may experience some minor bleeding and bruising at the site of needling. You may also experience some sweating, nausea, or dizziness during treatment depending on your tolerance of needles. This is quite common as the treatment stimulates a sympathetic nervous response. Less commonly, you may experience vomiting or fainting. This generally depends on whether you tend to these responses. More serious complications include a pneumothorax, which is a punctured lung. However, we've never seen this at the myoClinic as it is extremely unlikely to occur.
Generally, people experience some soreness, achiness, and fatigue following treatment. Bruises may last for a few days up to a few weeks. If you feel or see a bruise, you can put pressure on the area to reduce bleeding. You may experience numbness, tingling, or local skin irritation near the needle site. This usually settles out in a day or two. If it doesn't, or if you're experiencing more intense pain, please call us for an appointment as the muscle may not be fully released.
Our methodology differs in the way that our focus is more on anatomy and ergonomics. We aim to localize the root of your pain. Our treatment also involves the use of cutting-edge hollow-bore needles, which are much smaller than the needles used in acupuncture or IMS. The doctor will never leave the needle inserted, nor will it be moved around or stimulated. At the myoClinic, treatment is done by a medical doctor.
Most patients can drive themselves. However, those with predisposed condition or difficulties may benefit from being accompanied. If you have a long drive, for example, more than 30 minutes following treatment, we recommend breaking up the trip to avoid prolonged postures. This means pulling over in a safe spot every 15 to 25 minutes, getting out of your car, and walking around the car before continuing your trip. Additionally, we advise against biking to your appointment, as fully exerting your muscles following treatment could hinder long-lasting benefits.
For the first 3 to 5 days following treatment, we advise against doing any activities that fully exert your muscles. This means no heavy lifting, working out, or participating in sports at your normal level. We understand that there may be tasks that are impossible to avoid, but we can always provide a doctor's note free of charge for modified duties following treatment. If you are booked for 4 consecutive appointments during the first 4 weeks, we ask that you do not try to strengthen and instead do gentle stretches and short walks if desired. It is also important to make sure you avoid prolonged postures. After your first 4 treatments, appointments will be spaced out by 4 to 6 weeks. During this time, you may begin to engage in more activities. However, you should bring the intensity down to 30% of your normal and gradually increase intensity in a stepwise manner. More information about post-treatment care is available on our website.
You're welcome to use Hero Eyes after treatment, whichever feels best for you, but for no more than 15 minutes at the time to prevent burns or frostbites. You may also take ibuprofen or muscle relaxants to relieve the pain if this has worked for you in the past.
Ideally, during the first 4 weeks of your initial appointment, you should abstain from these other modalities to determine whether myoactivation is beneficial for you. After the initial appointments are done, you're welcome to continue with other modalities if you wait 3 to 5 days between treatments here and other treatments.
Everyone responds to treatment differently. On average, patients require 4 to 10 treatments. However, some may require more or less. This will depend on your medical history and severity and heavily depend on your post-treatment care.